We've now got Jamie Blackshaw-Team Leader, Obesity and Healthy Weight at Public Health England, and Professor Louisa Ells-Professor of Obesity at Leeds Beckett University, and they're going to present on the impact of COVID-19 on weight management service provision in England.
Thanks, Kath, and good evening, everyone. We've set ourselves quite a task. We've got quite a few slides, which I'm trying to get to work without much luck. And yes, so we've been looking, so thank you, Paul, for taking us through the some of that data on COVID-19 and the links to living with obesity. In PHE, we have a role to support local authorities with weight management. And so we've undertaken a collaborative approach, and we've been working with Adrian and Stuart to really look at and investigate the impact of weight management services in England. And we've been working with a variety of different organisations, including local authorities, providers, and also service users. And Ken is also speaking on this agenda today. We can move on to the next slide, please. So why look at this? Well, in March, there was advice from NHS to community services to cease behavioural weight management services. And there was also advice to Tier 3 clinicians to think through and prioritise who they should be assessing and talking to at the time. However, it became obvious to us that there was discussion between providers and local areas that they were still delivering some form of services. And clearly in PHE, we felt that we needed to act to understand the extent to the impact, and particularly because we're concerned about the impact on people living with overweight and obesity and having access to these services. And we wanted to share the key learning and some principles. And those are some of the things that we're going to talk you through this evening. So if we could move on to the next slide. Paul's already given us an overview of why this is so important in terms of context. So I'm not going to labour the point here, but people with COVID-19 who are living with overweight or obesity compared with those of a healthy weight are at increased risk of serious COVID-19 complications and death from COVID-19. So could we move on to the next slide, please? I wanted to make sure that we were all on the same page with where weight management sits within the context of a whole systems approach. And in PHE, we see that weight management and obesity services are an important component, but they're only one component as part of a whole systems approach, and that's at a local and at a national level. And it's within that whole systems approach that they are contextually important. PHE is committed to be working with government to improve the environment and the environmental drivers, because we know that they're a major driver of obesity in this country. So without further ado, I think we're going to hand over to Louisa now.
Thank you, Jamie, and thank you for inviting us to come and speak to you this evening. So I just wanted to give you a very brief overview as to the project we've just undertaken. So the scope of this project was to explore the impact of COVID-19 on family and adult Tier 2 and Tier 3 weight management services in England. So this is a programme of work we undertook in 2 phases. The first phase was to explore what is currently happening and what we can learn from this. And the second phase is to really think about and explore what needs to happen in the future. So we've literally just completed phase 1, the aims for which were to understand the impact of COVID-19 on people living with obesity and changes to weight management commissioning and delivery, and also to explore with weight management and service providers, commissioners and users how services need to adapt and flex in response to the recovery strategy, but also to have a think about what measures are required to facilitate these changes. So if we could move to the next slide. So in order to undertake these aims, we developed a series of 6 research questions. If we could move on to the next slide, which we undertook using a rapid mixed methods piece of research with multiple stakeholders, and it was very much a collaborative approach. I've summarised the methods we used in the table below and include 4 surveys that went out to service users, providers and commissioners. These 4 surveys were run by our colleagues at UCL and University of Leeds. We also undertook a series of 8 regional webinars. We undertook a local authority survey. We collated some local practice case studies, and we also undertook wider consultation with our Health and Wellbeing Alliance and colleagues and patients within our patient groups and BAME communities. So if we could move to the next slide. So really, I just wanted to give you a quick overview of our preliminary findings. So first and foremost, when we looked at the impact of COVID-19 on people living with obesity, we found that children, young people and adults living with overweight and obesity were concerned about the increased risks associated with COVID-19 infection. We found that the pandemic had actually reduced access to weight management services and support for children, young people and adults, and that many people living with obesity were actually using food to manage their emotions. And we noticed that COVID-19 had adversely impacted upon self-reported dietary and physical activity behaviours in this population. So in terms of the impact of COVID-19 on service provision, adaptation and inequalities, unsurprisingly, we found that face-to-face weight management services had been suspended as a result of COVID-19. The impact of remote provision on client engagement and uptake actually appeared quite variable across England. Some services had progressed well and rapidly in terms of adapting their programme to continue to provide support through remote delivery. This was offered via a variety of different delivery approaches, which include things like activity packs, telephone support, social media and online support. We found that one-to-one telephone support services seem to be very well received by clients most in need and those without internet or IT access. And we found that remote services really did provide a potential to reach a large population and also to engage populations who can't or did not wish to engage in more traditional face-to-face groups or sessions by removing things like travel barriers and providing an opportunity and an approach that can fit more easily around other commitments. We also found that online safety, reduced client engagement, resourcing issues, evaluation and reporting were all identified as potential challenges to remote service provision. The potential impact of service adaptation and the impact on inequalities was frequently raised, with further work really required. Oh, sorry, can we flip back to the other slide, please? To understand the impact on BAME communities in older adults, families living in deprivation, and particularly our most vulnerable communities. There really is no one-size-fits-all to adapted weight management service provision. It's really important to understand what works, what doesn't work, for whom and why. There is certainly a role to support remote support, but this needs to be part of a range of different approaches and delivery methods in order to serve the widest possible population and to ensure we eliminate any potential inequalities in access. If we could pop to the next slide. So in terms of impact on weight management commissioning, it is very much early days, but there is definitely a sense that the COVID-19 pandemic has and will impact upon future weight management commissioning. And there's a real sense of around the importance of ensuring that weight management remains a priority and that learning from service adaptations informs and develops more resilient future services. So if we could pop to the next slide, please. So we have a range of outputs and next steps that occurred as a result of this work, and I will pass you back to Jamie, who will talk you through these.
Thanks, Louisa. Yeah, if we could move on to the next slide, that'd be great. Because I think we've obviously got too many slides, but they're going to be there on the ASO website, which is why we've put so much together, because we've got so much to share. Translating what we've learned and what Louisa's been through is fundamental for PHE. And so we are really actively thinking about what can we do to support commissioners and public health colleagues at a local level, but also providers of services and importantly service users. So we've come up with some guiding principles, because there's lots of guidance out there for weight management providers and commissioners, but these are unique times, and so we believe that guiding principles might be the best way forward. In terms of practice and the provision of services, then clearly providers really need to be consulting with service users, as Louisa said, about preferred modes of delivery and how people want to engage. And the use of non-stigmatizing person-first language is obviously essential. So if we could move on to the next slide, please. And I think if we move beyond that, but if we move to the next one, clearly commissioners want to look after their local communities and do best by them. And so supporting people living with obesity through any transitional changes is quite key, because we could lose touch with people, and that's not what anybody wants. If we move on to the next one, and you can see I'm really picking up pace here to get through these service users. You know, this is key. This is stuff that we're working with Ken on, who's already had a look at this, but we want to work with others as well to make sure that we get this right. Not everybody has access to the technology to participate. So we've got to really think through what can we do in going forward. If we move on to the next one, I just want to talk about the next steps very briefly. There's lots of research that still needs to be done. If we move on to the next one. Most importantly, what are PHE going to do about it? We're going to provide the draft guiding principles. We're going to publish the report. We're going to share all this learning with colleagues in Department for Health and NHS and NICE, and we'll hopefully publish that soon. And phase 2, which I think is worth just spending 10 seconds on, is, yes, there's lots more work that has come out of this that we really want to build upon. And it's not just around weight management, but it's also about, and this came through from our local colleagues, the importance of whole systems working, and that during these times, that is ever so much essential to align and connect activity to support people living with obesity, and also to get services restored. And just want to say thank you for listening to us today. Thank you.